Kanyangi. My name is Leah Aoko. I'm a research associate at the Africa Research and Impact Network. I'm a lawyer by background, and I'm currently doing policy work with the organization. And this is one of the projects that I am leading on. Its title is Redressing Equity Through Evidence-Driven Response to COVID-19 in Africa. I know the title is a mouthful, so basically we refer to it as the Knowledge Translation Project, and it is funded by the IDRC. And we are implementing it in collaboration with the East African Community member states. So before I begin, it's just a trigger warning that it's a lot of text, but I'll try to take us through them really fast. I can't promise a lot of visuals, but I hope the explanations will be making sense. So basically right now we are finalizing the evidence synthesis report, and that is what I'd like to be presenting on. As part of the introduction, prior to the outbreak of COVID-19, we know that Africa had already been perennially saddled with numerous socioeconomic challenges. So unemployment was a challenge, adverse effects of climate change, poverty, and gender-based violence. The pandemic, however, exacerbated the state of these socioeconomic aspects all across the continent. And for marginalized societies, it deteriorated social structures. We saw that there was limited access to educational facilities. We saw how the youth were affected. So many people were laid off their work. So many people could not access crucial healthcare, and this became a huge issue. It also highlighted the gender divide and the state of equity across the continent. And one of the major impacts of the pandemic came from restriction of movements, which affected, of course, education, trade, economic activities, local and cross-border migration, health services, etc. So this overall, the pandemic greatly retracted the gains of social equity in Africa. And so in view of this brief background, the objectives of this project is two-pronged, and that is one, to provide a situational analysis to identify the current approaches to equitable COVID-19 management and recovery in the context of climate change within the EAC. So specifically, we'll be identifying policy responses. How was evidence used to address COVID-19? What kinds of evidence were and are being used? How are they used and how are they ushered into the COVID-19 planning process? We are also going to identify priority evidence needs and potential gaps for African governments, with specific focus on the East African region about the impacts and response to COVID-19. So how did it intersect with climate change? How did it intersect with gender issues and social justice principles? And then thirdly, we are going to look at how to synthesize, and we are going to synthesize evidence and develop a research agenda on priority evidence needs for African policy makers. The second prong of this objectives is to identify best practices and lessons on equitable COVID-19 management and recovery, to generate lessons and learning frameworks on best practices, and to characterize knowledge translation using this framework and using the COVID-19 experience across the continent. So as the work package summary of this project is one, having the evidence priority setting and stakeholder needs analysis. This has already been done through a regional policy lab that happened here in Nairobi. We invited the various policymakers under the East African Community who came in and addressed how did they manage the COVID-19 situation in their various countries, in their various contexts, which policies were put in place, why were they put in place, and what is the evidence that informed that the various policies that were being implemented. And then under work package 2, which we are implementing right now, we have the evidence synthesis. And here we have an evidence synthesis text that is being finalized. We have policy advisories. We are developing a literature database, working papers, and a journal article as well as part of this work package. And then we'll have another workshop under work package 3 for evidence exchange and uptake by the policymakers. and then we'll delve into learning and knowledge translation and practice, because we want at the end of it all not to just have a paper, not to just have a report, but how can this report translate into something that policymakers can use to inform their mandate? And then, of course, other aspects are on project management and monitoring that is occurring throughout the implementation session. So here in the project inception activities, this was under work package 1 and flowing into work package 2. We had an introductory webinar for the project on 5th May, where we invited experts from Kenya, Tanzania, Uganda, and some EAC representative. We also had a stakeholder engagement with the EAC that I have alluded to. We have set up a project advisory board that encompasses experts across the EAC on matters climate change, matters health, and matters gender equity. We also have done a situational analysis on how the partner states have responded to the pandemic, implications for various social groups in light of the existing shocks such as climate change. And we had a co-design inception workshop, which I have alluded to as well. So from the co-design workshops, these are the priority evidence questions for the evidence synthesis that we are looking at the current stage of this project implementation. And one of the questions is evidence on the efficacy of policy, institutional, and social strategies in the pandemic response and recovery. 2, evidence on COVID-19 implications on aggravating supervening factors such as social inequalities and climate change. And then 3, evidence on the degree and mechanisms of research uptake in pandemic response and recovery. Now, one may wonder, why are we looking at all these aspects and COVID has come and long gone? One is because we have to derive lessons. We have to be prepared as a continent for the next pandemic, which might hit us just as much as COVID-19 did. And we do not want to have missed out on the opportunities to look at what are the best practices, how can we have a smooth mechanism of research uptake during a pandemic response, how can we avoid exacerbating the current situation in social inequalities across the continent, and how does a potential pandemic intersect with the adverse effects of climate change? So this project is actually crucial to us being better prepared for future emergencies, especially those that occur within the health sector. So in addressing evidence of the efficacy of policy and institutional and social strategies in the pandemic response, we are all cognizant of the fact that there are a number of policies put in place. I mean, it wouldn't have fitted in this text really, but each and every East African country had a raft of policies that they put in place. They had committees that were informing various national plans in combating COVID-19. They had social strategies. We had language like churches are not going to be open. We do not have weddings anymore, or there's a limited number of people that will be allowed. There's a lot of social distancing in even the transport sector, and in various institutions, in banks, in schools. Some academic institutions were closed down, etc., etc. So all these steps were informed by policies, they were informed by specific institutional frameworks and social strategies that were put in place across East African countries. And they were aimed at curbing the pandemic and working towards a recovery process. So various research studies have focused on the impact of policy-informed containment measures set up by various governments. Unfortunately, these measures, which included lockdowns on different community groups, had negative effects, and they were influenced by these laws that became legally binding. We all remember in our countries where there are curfews that were put in place, and specific people ended up in police custody, some of them disappearing, some of them even dying in police custody. So this really brings to light the impact of the policies that were put in place to curb the pandemic at that time. And so these are some of the measures that I have been describing: frequent hand washing, social distancing, sanitizing of hands, change in transport arrangements, closing of borders, restrictive border movement, social distancing in public means of transport, and banning of social gatherings, enforcement of curfews, etc. So these measures were difficult for some social groups to implement. Hence the criticism that the policies and institutional frameworks that were put in place were not I wanted to say proper, but were not informed in such a way as to address the needs of vulnerable groups of people. Remember, when you're talking about social distancing and within an informal settlement, it's practically impossible because of the nature of housing, because of the nature of their interactions. When you talk about frequent hand washing, some people do not have the luxury of access to water. How are they to align themselves with these measures that are being put in place? When you talk about transport arrangements and enforcement of curfews, you know, some people, their business booms at night, or they really rely on the traffic, maybe in an urban setup, for them to sell more. So the various there are various dynamics that went into the implications of these policies that perhaps the policymakers did not put into mind when they were thinking about these measures. And one really, this is just an example that I'm going to come to, but one really common critique was that the policies were Western informed, and they were further informed by the need, the global narrative to flatten the curve. So whatever the WHO, the authority at that time was advising for countries, that is what we copied and pasted into our context, forgetting our dynamic and context-specific situations, forgetting the vulnerable groups that we have, forgetting the implications on these vulnerable groups, and forgetting the already existing supervening factors such as social inequality. So that trend of policymakers or committees that were put in place, just putting down a framework that was Western informed and was not context specific, had its challenges, because we found out that, for example, in Africa, just as I have said, the people in informal settlements, you know, there are women who are largely disadvantaged by some of these measures that are put in place. There are men who are largely disadvantaged by some of the economic measures that were put in place. So it's a very common critique that copy and paste of policies, instead of being context specific, did not favor our continent. So I'll just use an example of Kenya. And here, during the curfew, there were received complaints of police violence, cases of death, physical assault, sexual assault. There are numerous cases of gender-based violence, as we're going to see in the next evidence question, that have been reported. And these are just the ones that were reported to the Kenya National Commission on Human Rights. So the probability that the numbers could be higher is 100%, you know, because not all cases, not all victims, or not all survivors were in a position to report during this pandemic period, owing to the policy measures that had been put in place. Of course, the measures to respond to COVID-19 exacerbated risk factors for vulnerable groups, women, young people, persons living with disabilities. Yes, these were persons who were locked in their homes with their abusers. Remember, no one is allowed to go out. So survivors and abusers were in the same environment, basically, leading to an increase of physical, emotional abuse, rape, sexual exploitation, FGM, and early marriages, all on the rise. And this was witnessed in each and every East African country, at least as per their reports, because this evidence synthesis has looked into the national reports for each and every East African country. So this is a common trend, or rather it was a common trend across all the countries. So the second evidence question was on COVID-19 implications on aggravating supervening factors such as social inequalities and climate change. So here, just building up on the narrative of gender-based violence that was witnessed, the psychological abuse, and that lack of societal structures, proper societal structures during the pandemic. was witnessed. An increase in mental health deteriorating during this period was also witnessed. And it just leads us to the fact that maybe we do not plan properly around our interventions as a country or as a regional bloc. In terms of climate change, according to a virtual leaders dialogue on African COVID-19 climate emergency, which was organized by the Global Center on Adaptation, the GCA, and the African Development Bank, it was noted that the country's GDP had dropped by 3% in 2020, of course, owing to the effects of the pandemic. And the aftermath of the pandemic has seen more governments being urged to grow the green economy. So this was the slight correlation between COVID-19, its implications, and climate change, just the urge of African governments to build back better, but to build back better feeding into the green economy, because it was evident that the socioeconomic impact of the pandemic resulted into more pressure on natural resources, hence increased exploitation. So basically, for communities, especially for communities that depend on natural resources for survival, the state of affairs during the COVID-19 period was such that it put more pressure on the use of the already scarce natural resources. The effects of the COVID-19 pandemic were highlighted to have come against existing shocks, which I have mentioned, including climate change. So basically, it was an increase, a double trouble of some sorts. According to scholars, also, a second aspect of how to look at it, the correlation of COVID-19 and climate change, some research scholars are saying, look, the way the whole globe rallied around the global narrative of flattening the curve, rallied around vaccination, rallied around protection measures and sanitation. Can we do that for the adverse effects of climate change? And this was their argument, because they said, for years, we have been trying to mobilize resources and funds to address climate change, yet this pandemic comes in, and within a very short while, the WHO has taken over. It is giving directives. Countries are aligning themselves with what needs to be done. And of course, it took some time, but over a period, the pandemic was collectively tackled. It was viewed as an international emergency. National policies were aligned to tackle the pandemic. So the argument is that, why can't we do this for adaptation measures? Why can't we do this to make our vulnerable communities more resilient? Why can't we do this in terms of mitigation? So yeah. The last correlation I can say is, although research studies do not clearly point out as to whether the adverse effects of climate change resulted or increased the impact of the pandemic, there are preliminary studies that showed that persons living in cities with poor air quality were more prone to dying from the COVID-19 virus. So the point here, and I read a paper where it pointed out China as an example, saying it's because of the really poor air quality systems that so many people died out of the virus. So they're just arguing that, cities that were more vulnerable were those cities with poor environmental strategies, poor air quality, cities that already the impacts of climate change were being heavily felt. And so they were more vulnerable than other cities. So this is just a diagram to illustrate that. And I found it very interesting because it starts with climate change at the head and then goes to the causes: global warming, changing humidity, deforestation, air and water pollution, industrialization, and then going to the consequence on the environment. And this consequence on the environment includes changes in bat and pangolin population and distribution, and alterations in host immunity and microbiome and comorbidities, yes. And then alteration in the virus and emergence of mutants. And then, of course, natural disasters, etc. And this is now being related to the fact that it's because of this consequence, or it's because of these changes, that predisposed the world to the emergence of the novel coronavirus. So basically, the argument here is that there could have been some genetic changes in the bat population that predisposed certain populations across the world to the novel coronavirus that then spread globally. So I found that research to be thought-provoking. The third evidence is on degree and mechanisms of research uptake in pandemic response and recovery. And this, I'd say, is the gist of the project, if you asked me, because the previous discussion are things that we are very familiar with. We are very familiar with how, or at least by now you should be familiar with by virtue of my presentation. We are very familiar with how COVID-19 affected social equity, with how COVID-19 affected policy response, institutional mechanisms, with how it reflected on inequalities across the board, and climate change as well. And so here we're looking at, okay, what was the degree of research uptake during this pandemic response? And this is what we asked the policymakers during our first policy lab consultation, is that what informed, you're telling us that you put down 1, 2, 3 policies, what informed that policy response? If you're telling your people, if you put a curfew at 6 p.m., what informed that curfew? Or what informed shutting down of shops? You know, what research was used? Are there mechanisms that were provided to the government agencies, or was just that as a result of Western informed measures? So the role of evidence in supporting COVID-19 response and the preparedness of EAC states towards future pandemics is critical. Experience shows that COVID-19 coexisted within the social context and other challenges such as climate change. Thus, multidisciplinary evidence was necessary to inform response and recovery. And this we have seen from the health sector that was affected, from the education sector that was affected, from the economic sector, trade, the regional laws. We saw some countries even having diplomatic laws. I think it was Kenya and Tanzania having diplomatic laws over the closure of their borders. So various sectors were affected because of the COVID-19. So it's very important to reflect on that. However, from the co-design workshop, there's limited insight on what models of research and evidence uptake can work and what lessons can be drawn for a better COVID-19 experience. Because we cannot say that today, if another pandemic occurs, we're going to lock up people again. We've seen that the police violence increased during this period. We can't say that we're going to do the same thing, which could potentially achieve the same detrimental results. We have to learn from our past mistakes and probably borrow from best practices on how we can face future pandemics. So from the foregoing discussion, global narratives were mostly employed as evidence. When we asked the various representatives, all countries had, I think all the 6 countries had committees that were, yes, multidisciplinary, yes, they're multi-stakeholder informed, like representatives from the various sectors were there. But our question was, what evidence were they using, and how did they reach? What was the degree of evidence or research uptake? And here we see a bit of a disconnect, because what the scientists knew could work is not probably what the policymakers were effecting through their policy changes. So the gist of this project is to see how in a future pandemic, how can we have a proper knowledge translation framework in such a manner that scientists or researchers are able to act in a pandemic response in such a manner as will make sense to the multidisciplinary policy makers or the multidisciplinary committee that will be put in place to address an emergency. So because I remember very clearly that there are a lot of rumors on the nature of the COVID-19 virus. Some people not even heeding to the measures that are taking place. Some people disregarding the measures because it was very, it was hurting them economically, and some also suffering socially from the same. So it's very, very important that these two quote unquote silos come together and see, in case of a pandemic response, how best can we go about it. So to bolster its uptake of evidence, most EAC countries had multidisciplinary committees in charge of containment measures. Some of them who probably did not have vulnerable groups in mind. Maybe there are no vulnerable representatives from vulnerable groups. Properly so, because it was an emergency, right? Everyone was trying to do everything within the shortest time possible, but they received criticism for taking into account the plight of vulnerable groups, for taking into account the implications of the preventive measures that they had. COVID-19 mitigation needed to look beyond the purely epidemiological medical front and consider economic, psychological, environmental, and social disciplines to generate strategies that will positively impact populations. So for example, if there was a proper research mechanism, or social researchers who would say, this is how these measures are going to affect certain societies, then the policymakers would be able to relate with that and reflect that in their policy making processes. So instead of just telling people, yes, we want to eradicate the virus, but what are the implications of that? Is a curfew necessary, for example, right? How can we ensure that, let's say, women are still able to access health centers? How can we ensure that persons in the informal settlements are not disadvantaged? Can we extend their operations, in the evening? Or how can we help them economically? Are we doing food assistance programs for them? So there are still other measures that could have been informed by proper research uptake. That was not the case, and resulted into new groups of vulnerabilities, resulted into criticism for these quote unquote elite committees that sat down, put in place policies, put in place measures, oblivious of the fact that already on the ground, several groups of people were suffering as a result of the pandemic measures. So in conclusion, this is what I'd like us to reflect about. What are the lessons from the pandemic experience and response? We already have some, probably very familiar with most, yeah? What can be done to translate scientific research into informed, proper policy mechanisms? Because this is what we need. Research has to make sense to policymakers. That is one of the major ways we can make an impact. And to do this, we need a proper knowledge translation mechanisms for formulation, policy for formulation to implementation that is context specific. So what works for the Western countries is not necessarily what will work for us. So how to effectively engage stakeholders even in cases of a global emergency. In case we have another emergency, how can we as African countries, or more specifically, how can we as East African countries come together to tackle a global emergency in a very context-specific way, such that even if we have these multi-stakeholder, multi-sectoral committees, they have proper research, they have proper interventions that will then inform effective policy mechanisms that do not exacerbate the already existing dire conditions in our society. So I think I've just done my best to shed light on that. And yeah, that is the end of my presentation. Thank you so much, Juliet. Questions and comments are welcome.
Thank you so much, Leah. I think that was a very power-packed message. Good job for that. But I see a lot of concerns and questions in the comment section already. But before I take any of those questions, and of course, if you also have a question, please feel free to raise your hand and I'll be happy to let you speak. So at this point, I want to bring in our Director of Partnerships, that is Brian Ower. To kind of also give us a little bit of his opinion, as he was also involved in this project. Brian, please.
Thank you so much, Juliet. I think my part in the project has already been highlighted by Leah. We were just doing some literature review regarding the whatever has already been done around COVID-19. Just to kind of just shed some light on question from Mary, if the gender aspect was considered during. Okay, so we are kind of developing a database of the literature and publications around COVID-19 and the social equity in East Africa community, and now linking each and every journal or publication to the different objectives that we have for the project. So we'll share these maybe when the project comes to an end, because it's a very comprehensive database with the focus of each and every publication and the outcome of each of the publication, and of course linking it to the different objectives.
All right, thank you so much, Brian, for shedding light to that topic. So before I read the questions, firstly, let me apologize to our Francophone present in the call today. We weren't able to secure interpretation for you, but we are working on that. Trust me, we'll try to have an interpreter available for you next Friday. And also, we're currently working on translation of our material and slides, as this has been a concern, and all of this will be sorted in due time. So let me just pick on the first question from Mari, and she's asking which were the East African countries that were part of this study. It would be great to just mention the coverage. Leah, would you want to respond to that, or should I take another question?
Just quickly, because it has started in a simple manner. Kenya, Uganda, Tanzania, Rwanda, Burundi, and South Sudan. Yeah.
All right. Thank you so much, Leah. So the next question is, I think Brian has answered this, but I'll just read it just in case, Leah, you want to shed more light again. Did the assessment take cognizance of gender effects of COVID-19 on social equity, and what percentage impact by gender across East African countries were covered? And then the next question is, what research methodology was deployed in this project to generate the evidence? I missed out on this during the presentation.
Okay, so on the gendered effect of, yes, we did. We actually, the second evidence question is on the gendered effects of COVID-19 and social equity. And what we've done is an analysis of all the East African countries across the EAC, which is the database that Brian is alluding to, that we are streamlining right now. But yes, we did take cognizance of that, and we have specific percentages, numbers that were reported during that time. The main challenge would be not all cases were reported. Probably a large number of cases were not reported owing to the containment measures that were put in place during that time. So what we have as figures are not entirely accurate, but that is what we are relying on, and from the human rights organizations across the EAC. So yeah. So the next question was on the research methodology. We did specific interviews, and this by virtue of having a preliminary webinar, it gave us insight into what specific people we should be targeting, who as part of the ESC Secretariat we should be targeting. And we were in touch with the ESC Secretariat in charge of health, who gave us a lot of insight on that. We also had policymakers during the workshop, and we were able to deliberate around the impact of COVID-19 and to generate more evidence around that. They also led us to their country reports that we used to evaluate through a desktop analysis to mine more of the evidence that we needed to formulate the report. So that's just part of the methodology. Merci beaucoup. Bienvenue. Yeah.
Thank you, Leah. Just maybe to add on,
Yes,
under
please.
the methodology. Of course, our inclusion and exclusion criteria for while scoping for literature, we included COVID-19, gender, social equity, economy, economical disturbance, and all those aspects that were kind of alluded during the presentation as part of the inclusion criteria while looking at the literature.
Yeah, thank you so much, Brian and Leah. I don't see any more questions in the comment section, but I'm wondering if anyone else has a question. I know this is quite complex study, also being that you're hearing about it for the first time. So I'll kind of share this presentation with all of you so you can go through it. And if you have any questions, you can send them through our email address, or you can reach out directly to Leah with her email address, which she has shared on the chat. Thank you so much, Leah. I think that is very useful to those who'd like to follow up. But I think this is a pertinent question, bearing in mind that we just came out from a pandemic and we're thinking about how to bounce back from this. So that is all right. I see Marie has a question. What is the timeline for this project? It is a good project. Thank you, Marie. Yes, it is a good project. Brian, do you want to respond to the question on timeline for the project, or Leah, you can take it?
So the project ends in April, unfortunately, but it has the possibility of an extension. We have a final validation workshop with intergovernmental organizations across the ESC on April 23rd. So I've just put in my email and WhatsApp contacts. If you're interested to contribute to the same, I'll be happy to involve you. Yeah.
Thank you so much, Leah. Brian, I think that was a very good presentation, quite complex, but maybe we need to have another session on this topic again so that we can just kind of take more time trying to make our participants understand more about this project. But I see our executive director is on the call, and I'm sure he'd be happy to also speak more about the project, but also to give his kind of final remarks, even as we draw towards the end of our presentation today.
Thanks, Juliet, and thanks everyone, and greetings from Cape Town. I've joined late, so I may not be privy to some of the discussions. Just to highlight that this kind of reflective study or research is very fundamental for us, and of course for African stakeholders, including governments, and also organizations that are mandated to confront various shocks that the continent faces, COVID being one fundamental one. And so the big question around how to prepare better, how to learn and prepare better for such shocks is one area that is a big gap in Africa. And so it's fundamental that we begin to understand really what are some of the ways in which preparedness can be enhanced towards these shocks, so that the reactiveness that we have seen in most African contexts when we are faced with such issues like pandemics, can be toned down, because this kind of reactiveness, as you are aware, in the context of most African countries, resulted into what I would call double vulnerabilities. Double vulnerabilities in the sense that people who are already suffering the impacts of poor access to health facilities, poverty, impacts of climate change, were again exposed to a new form of a shock that then actually was a bit complicated because it's of global origin, but the impacts are very severe and very acute at the local level. So then this means that as a continent, we must reflect better and see what is it that we can learn in order to build better frameworks for preparedness. How do we create opportunities or strategies that can enable systems to be ready for such eventualities, even if it is just for a bit of the readiness. It doesn't have to be full. Of course, we want to accept that emergency response is still going to be a key part of managing such shocks. But at the same time, I think thinking to be able to create strategies for proactive risk preparedness is something that is very fundamental moving forward, because then the damages that occur without preparedness are always enormous, and some are too costly compared to the cost of putting in place preparedness systems. So this is really very important. I want to also understand that I know people have forgotten about COVID. I was just discussing with a number of colleagues here in Cape Town, guys, people from different universities, Arizona State Universities, Bill Gates. I was just trying to, tell them that in my country today, the issue of COVID is like forgotten, and we're actually waiting for the next pandemic so that we react. But we are saying, wait a bit, what have we learned? And this is not a responsibility of anyone else other than us. So in this study, what we are trying to also do is to say, wait a bit, what are some of the best practices that we've learned? What are some of the ways in which a pandemic of this sort could be addressed better? How can evidence be used, better to really build preparedness framework? And what are some of the best, some other best practices from elsewhere that we can bring into this particular process? So this project is basically about developing some of these best practices that are able to really confront these shocks, or were put in place to be able to confront COVID, but also to ensure that there is safeguarding the resilience to other existing shocks like climate change, because then COVID coexisted within the context of other shocks like climate change, poverty, and so it wasn't in isolation. So how did the responses to COVID really safeguard? How did the process through which countries respond to COVID? How did that enhance this resilience to other shocks as well, or did it exacerbate it? And if there were situations where a response to COVID was more supportive, equitable, and also contributed to enhancing resilience to shocks like climate change, so we want to know which ones are these cases. Then we use these particular best practices to help the East African community to be able to build a much more robust pandemic preparedness framework that then can be adopted by the East African Ministerial Council. And we are able then to say, in case of any other pandemic, these are the options, these are the steps, these are the best practices, this is the way that we need, these are the data systems that we need, these are the the kind of infrastructure skills that we need to put in place to ensure that this happens. So this is a really very interesting part of the process, reflecting backwards, but looking more into the future, because even Africa today do not have a clear pandemic response framework. even at the AU level. So there are strategies, but there are no pandemic response, framework that could then be used to prepare states better. The second part of this work is also to use these learnings to be able to build what I call the knowledge translation framework, because one of the things we are looking at, as we've said, is evidence. How did evidence flow into the decisions that were being taken? So that is very fundamental. So the second thing we're saying, okay, out of this evidence, how did it happen? What are some of the best cases in which evidence was used to support response? And what pathways did that happen? And in what ways? What were the impacts? What were the factors considered? And then use that to develop a knowledge translation framework, which then again can actually be taken up by various programmatic areas in terms of trying to ensure that evidence is actually linked to decisions, not just during pandemics or during emergencies, but even for long-term risk preparedness and for long-term stability of our economies and livelihood. So basically, just to say, yeah, grateful that this discussion has gone forward, and I think we will continue of more robust engagements around this particular topic. Just also to highlight, we have the book on COVID, lessons, based on our 2020 conference that is coming up. It's been a long haul, but now we are basically in the tail end of it with publication under the Taylor and Francis. So a huge opportunity to create influence. This is going to be one of the first books that is talking about reflecting on the lessons that COVID offers to Africa's public policies in a way that is quite integrated. So I want to say thank you, and yeah, wish you well also, and also ask that we continue engaging in this process. Back to you, Juliet.
Thank you so much, Dr. Taylor. It's normally very hard to speak after our ED, but thank you for very insightful closing remarks, and also for just shedding light about the project and what really this means for Africa as a continent. So at this juncture, I think we have come to the end of today's session, but just before we go, first, thank you so much for joining us. For today, I forgot to actually ask where you're joining from, but I can see Benedict from Ivory Coast, Emmanuel Chuku, and so many people also joining us from West Africa, both West and East Africa, and also few Francophones. So thank you very much for making time to be part of the session. We do hope that it was helpful to you. Now we want to thank you, Alvin from Cameroon. We are privileged to have you today. So at this point, we want to take a virtual selfie, and our media team is on standby to capture those cute smiles for our social media. So kindly let us turn on our cameras, and we are looking forward to taking a virtual selfie with each and every one of you. And as we do that, thank you so much, Leah, for breaking down this topic to us as well. That was an excellent and very succinct presentation. We look forward to having more sessions with you also, just to give more light about this very critical project. I can see we have quite a good number have turned on their cameras. Brian, are we on set? Awesome. So at the count of 3, I'll invite us to smile just as we do it every Friday. So 1, 2, and 3. All right, I can see a signal that we are all good. So thank you very much. And it is always a pleasure to see all of your faces so vibrant. And thank you so much. Let's meet again on Friday at the same place. And we have a very interesting topic for you. So you can't afford to miss Friday's session. Also, please do let me know if you'd like to present in one of our reviews, and all of this culminate into our international conference where you can also get a chance to present your work. So do hit me up on j.olwatch@arene_africa.org to book a session for the presentation. So thank you very much and see you next Friday.
Thank you, Juliet. Good job.
I see we have more people on the call.